Hi guys, Kirk Johnson with Johnson Chiropractic and Acupuncture. I wanted to speak today a little bit about food sensitivity testing options. So now that a lot more people are understanding how food affects their health and the conditions that they may be suffering, you have to figure out what foods are causing the issue. So I've done a Facebook Live on this probably a little bit over a year ago, but I wanted to kind of readdress the situation. So there's multiple different ways to test a food sensitivity, but first off we have to understand a food sensitivity is not a food allergy. So a food allergy would be considered something that would cause like an anaphylactic histamine response. Usually you're going to know if you have a food allergy or a specific allergy at a fairly young age because you are going to have that anaphylactic type reaction. Now, a food sensitivity is something that builds up over time and creates inflammation in the GI tract, inflammation in the small intestine, large intestine, sometimes the stomach, and creates and increases inflammation in the entire body. So to figure out if you have food sensitivities, what do you do? So there's a few different testing methods for food sensitivities. So there's something called an IgG and an IgA test. That stands for immunoglobulin G and immunoglobulin A. And IgG testing can be ordered through a lab that I use called Vibrant America, and it's going to test about 100 foods. And it's going to give you results that say this food, your body creates an antibody to this, and the food would be called the antigen. And then it's going to give you a severe and a moderate reaction, and then no reaction. So an IgG and an IgA test is a good place to start. Saying that, however, that's not testing every immune pathway against that food. So it's a start to understanding what you may be sensitive to and what could be creating issues in your body and further contributing to whatever condition you have, if it's leaky gut syndrome, irritable bowel, autoimmune disease, joint pain, etc. So an IgG or IgA test is limited in its findings just because it's only testing those immune pathways, but it's still a start, and you will show some foods that you may react to. And I'm going to show you some examples of the testing here when I get done speaking about it. The other testing method we can use, well, there's two more, Applied Kinesiology manual muscle testing. So I have vials that are what we call homeopathics of different foods, and we can test those using manual muscle testing and Applied Kinesiology technique, which I am certified in, and then determine what foods your body is reacting to. And that's more of a whole body reaction versus a specific immune pathway reaction. But I only have about 60 foods in vials that I can test. Some patients will bring in foods that they consume on a regular basis and have me test those as well against different reflex points in their body. The gold standard, at least to me, for food sensitivity testing is called the Alcat test. The Alcat test tests what we call whole white blood cell morphology. So it's testing against basically all the immune reactions, and that test goes from 50 foods all the way up to 250 foods. So you can test a ton of different foods. If you have a very diverse diet, you'd want to do the higher food count because it kind of includes some foods that's maybe not so normal in the standard American diet. So I have a chart of different combinations of foods. It goes from 50 to 100, and then it increases by 50 foods all the way to 250. So the Alcat test is the gold standard because it's going to show you how your whole white blood cell would react to that food, and then give you a really good picture of severe reactions, moderate reactions, and mild reactions to all these different foods that are tested, and then of course the negative foods that you can eat whenever you want to. So those are the different testing types for food sensitivities, but that's the first step to understanding how you heal the GI tract, how you heal yourself from within, because you can't feed yourself the wrong food and expect your body to heal perfectly. And that's one of the first steps I do in all my nutritional examinations, is determine what food sensitivities the patient has and how do we pull them off those foods. You need to avoid these foods. Then I usually recommend some different diets that kind of follow the guidelines that would fit for their food sensitivity profile, so that they're not eating things that are creating more inflammation and creating more problem in their body. Pricing varies for everything, so if you want to know the pricing, you can message me on Facebook or call my office and we can tell you, kind of go over the pricing of the different options. So I'm going to move the camera here for a second and show you the different testing and what it looks like. As the results go. So this is the test from Vibrant Wellness. This is the IgG. I'm going to focus on a little bit more, the IgG and the IgA test. This is a sample result, so you can see here this patient, if it was a real patient, would want to avoid tuna, shrimp, gluten-containing grains and oats, avoid cow's milk, egg whites, and then their moderate sensitivities would be casmorphin, salmon, cranberry, apricot, and olive. And then here's all their foods that they're fine to eat whenever they'd like to. So that's what the testing result looks like for the Vibrant Wellness IgG and IgA test. Now this is actually a patient's Alcat test. I've covered up their information so you can't see who it is, but you can see it's a little bit more in depth and there's a ton more foods on here. So it also gives you severe reactions, moderate reaction list, and mild reaction list. And sorry, there's a reflection from the light in there. And then there's the acceptable, no reaction. You can eat those foods whenever you'd like. The nice part about the Alcat test as well is it's going to give you an example of what we call a 4-day rotation diet. A 4-day rotation diet is going to change your grains, your vegetables, your fruits, your proteins, and your other miscellaneous foods every day. So say for protein, you're going to select one of these protein sources this day. The next day you'd select a different protein source, so you're not eating the same proteins every single day, which also can create inflammation in the GI tract if you're eating the same thing all the time, if you're flared up and if you're having inflammatory reactions. So it's going to give you a very nice and concise 4-day rotation diet plan. With the Alcat test, we'll get a free consult with one of their nutritionists if you would want that, but I'm here to help you with that as well. And it's going to explain also, I'm going to turn you around, it's going to explain all of the foods that you are sensitive to, and sorry, I got a little sideways here, foods that you're sensitive to and things that they might be in or could be like different names. Like, so if it's corn, it could be high fructose corn syrup or corn sugar, or for soy, it can be soy, or in an ingredient label, it might only say lecithin, which is usually derived from soy. So it's going to give you ideas of, okay, what can I eat? And I need to look at these ingredient lists, and if this ingredient's on there, well, that actually means milk, or that actually means soy, so I need to avoid that food. So that is the best way to do food sensitivity testing. Alcat test is my favorite. Applied Kinesiology testing is great because it gives us a good start. And then IgG, IgA testing through Vibrant America is also a good option. And it's usually a little bit cheaper than the Alcat test. The Alcat test goes up in price, especially when you're getting the 250 foods. So if you have questions about food sensitivity testing, write it in the comments, or give me a call at the office, 913-825-2550, and we can answer all your questions. Y'all have a great weekend.